Good morning. This is Dr. Susan Marra and Juju with Dr. Marra's Medical Minutes. Maybe I should call it Dr. Marra and Juju's Medical Minutes. And have you ever thought about why it is that so many people with tick-borne illness also have hormone problems, thyroid problems, estrogen problems, cortisol problems, uh, progesterone? Um, Well, let me talk to you about that today. So, generally speaking, the two organs in the brain, the hypothalamus and the pituitary, are largely responsible for governing the production of hormones in the body. And I'm just going to let's take cortisol. So, the hypothalamus sits higher than the pituitary and it releases something called corticotropin releasing hormone. And that stimulates the pituitary to release adrenocorticotropin hormone, ACTH. And then that ACTH goes down and stimulates the adrenal cortex to produce cortisol to help regulate stress in the body. And then when cortisol is high enough, there's a negative feedback loop where cortisol goes back and negatively inhibits ACTH release and negatively inhibits CRH. Okay, so it's a negative feedback system that's pretty common for all hormones. So why do we see such hormone dysregulation in tick-borne illness? Well, one of the reasons is because tick-borne illness very much causes neuroinflammation. And the neuroinflammation, which is the release of pro-inflammatory cytokines that activate things like the microglial cells and the astrocytes and things like that, that neuroinflammation very much affects the hypothalamus and pituitary by putting sort of the best way to think about it is it puts pressure on those organs. Those are tiny, tiny little organs in the brain. And when the brain's inflamed or brain on fire, then we have a problem with the effects of neuroinflammation. And so when the hypothalamus and the pituitary are affected by neuroinflammation, then you see hormonal dysregulation. And that can happen for thyroid, estrogen, progesterone, testosterone, insulin growth factor, cortisol, any of the hormones. And that's why you need to be on appropriate doses of thyroid or cortisol supporting herbs or Cortef, estradiol, progesterone, in order to reestablish hormonal balance, which is critical. Hormones are critical, and they're released in very low concentrations. I think on the order of picomoles or femtomoles, which is 10 to the minus 12th or 10 to the minus 15th. I hope I remember that correctly. I think that's correct. Anyways, so appropriate supplementation with thyroid, cortisol, estrogen is very necessary in order for your organs to operate properly. And so hormonal health is super important, and it's something that we test for routinely in this office. And we use the Dutch test, urine test, or we use blood tests through LabCorp. So, getting your hormones in balance is a very big deal, and you need to really take that seriously. You will never get well if your thyroid is off. So one of the first things we look at is thyroid and cortisol. because when those two things are off, you're not going to be able to get well. So you might want to talk to your doctor about hormone supplementation, not supplementation, but hormone treatment. And then, if you do need them, they're relatively easy to prescribe. And basically it takes about 90 days for your hormones to get back in balance. And then you recheck, and then you just keep going until you get it balanced. So I hope this video has helped you, and I hope that you enjoyed Juju, and have a wonderful day.